Hey, hello everyone. Good evening. Welcome. Hope all of you are able to see my screen and hope all of you can hear me. Can I have a quick confirmation, guys? Team, can you hear me? Could someone please confirm? Yes, perfect. Thank you. All right. Uh, I got one query from Priyanka. Priyanka, you mentioned that you have an issue with the medical history, correct? You're not able to see that, or you're getting an error, correct? So let me check from my end. Yeah, let me check from my end. I haven't get a chance to see that. But let me check now. So my data sets are clinical SAS, project one. This is the one that I have shared. Okay, so let's check. MH. First of all, it is getting open here. So let me. I'm just trying to create a temporary data set just by reading it. I'm able to read. Oh, okay. Some character data was lost during the transfer. Okay, so there is an alternative for it, and that alternative, let me try this. These are all formatting issues, guys. So try to match them here. So all I'm trying to do is I'm just changing this to SAS Studio. I'm just trying to check in the SAS Studio will it work or not. Okay, that's the only thing that I'm doing now. Now it is opening here, right? So Priyanka, what you can do is Priyanka and others also, whoever is doing this, just try to open this in your SAS Enterprise, right? Sorry, your SAS Studio. It will open here. Okay. It is all about formatting. Whatever the errors that you can see here is, these errors are happening because of the encoding, right? That is, this version of the SAS is not supporting the version of the SAS that is already created here. That is the reason we are getting an error. There is no issue with the data set. What you can do is just upload this particular data set into your enterprise, sorry, your SAS University Edition, or just go ahead with your SAS Studio. In the SAS Studio, you can happily open it, and you can also see that you are able to read it as well. Is that okay? This is encoding issue, guys. Nothing more than that. Priyanka, can you try this now? Whenever you get a time, just go ahead with this. Open your raw data set into your proper SAS studio. All right, cool. Those are like, these might be created in some of the inbuilt formats which are not supported in your version of the SAS that I'm using. That is the only difference. So no need to worry about it. You can open here and you can work on it. Other than Priyanka, I haven't received any responses from anyone. Means you haven't tried them, or you haven't get a chance to work on any of these domains, or what it is. I don't know. Guys, until and unless you start working on it, until and unless you start practicing them, you don't get anything. I'm telling you honestly. All right. So I'm just leaving it to you guys. So if you ask me questions, if you keep asking me your doubts, then I'll be happy. Okay, for date information, raw data, we don't have in AE domain. Which one you are talking about? If I'm not wrong, in the AE domain, we have completed it right already. Ankita, can you be precise what you're looking at? Are you looking for?
Yes, sir, you
Tell
did
me.
the date information, the raw data.
Just give me a second. AE1. Here is the AE1. So what is missing? You have your date information here, right?
So you done here, but well, I was trying now. You didn't share the raw data to us.
I haven't shared the raw data to you.
No, the for the date information.
Which date you're talking about? That's what I'm asking. Because the AE start date and time, AE end date and time, for that the data is already available in the raw data set. This AE1 have I shared to you or not?
Yes, but date information is not there in it.
It has. It has. See here. Start date. This is AE start date and time. I already told you I go with two different things for it. One is this is your AE start date and time. This is going to be your AE start date, only the time. If the time is there, then you need to do what? You need to do concatenation of your date and the time. If the time is not there, you can directly take this particular one as is. This is how we have coded already. Yes or no?
Yes.
Then what is missing here? If I'm not wrong, the only thing which is missing here is RFSTDTC, that is your reference start date and time in character format. This will come from your DM
Yes.
domain. Yeah, this one alone I need to share it with you. So I'll share the DM data set which is already converted with the proper SDTM one. That I'll share it with you. Okay, that is the only thing which is missing. Remaining all are there. Remaining all are there. Even in the class while I'm doing the coding also, only that particular one I have brought it from the other data set. You see, only for calculating your reference start date and time here, you can see, only for this I have taken the domain, that is DM domain, which is already completed. This domain data set, I'll share it with you. Okay?
Yes. Talking
Yeah.
about that.
Yeah, that's the reason I asked you precisely what you want. So
Oh,
the reason I have asked you is you need to tell me the variable names. That will make you to feel comfortable with the domain. Am I correct or not? That is the main point, right? Terminology you need to adopt. Guys, clear or not? So whenever I ask anything, try to tell me or try to revert to me with domain variable names. So when I ask you the date, I got it, what is the date that we are expecting, but you need to understand really here we need the reference start date and time and reference end date and time. These two are the variables which will come in the DM domain. Those variables you haven't shared with us are the respective domain data set you haven't shared with us. That is the answer that I'm looking for. That will give you the confirmation and the confidence that you are well versed with your domains. Clear? That is very, very important. All right. So DM domain code last week we have started, but we haven't completed that because some of the data is missing. Correct? So I still doing the reverse engineering for this. I need to get those data sets, proper details and all. I haven't get that yet. So I just keep this on hold, right? But it never stop you working on your code. These four you can still work on it, except your clinical events domain. The remaining four domains you can still work on. The AU domain, you can try to do it with your own thing. Don't look at the code that I have shared. On your own, complete your adverse event once. Then go with your medical history, disposition domain, as well as protocol deviation, right? Then I'll start with the interventions this week from today onwards. And the DM domain, we try to do it on Wednesday. Wednesday or Thursday, we'll do it. By the time I can make sure the data will be available so that you can practice these two as well. Clear? So today we will start with our interventions domain. First, I will start with concomitant medication because it's the bit, I can say that more number of variables will be available. So I'll start with the concomitant medication today. Okay. Anyone, any questions? Right. So please start practicing, guys. Only when you practice, you will come to know this. Otherwise, we will be keep on discussing the same stuff again and again. By the time we complete our course, you will be still at the same place where you are before starting the class. That is, you won't get any knowledge. So that's the reason I request every one of you kindly go with this particular one. Make sure you're going to have the details of all the things that we are talking about. Clear? All right, perfect. Now, go with the next one. So far, what and all we have discussed? We discussed about your special purpose domains, then we talked about the events. Now we are going to talk about the interventions, right? So interventions are primarily, so whatever the domains we have under the interventions, these domains are based on general observations. So mainly based on the general observations. So the first domain that we are going to talk here is going to be CM. The CM stands for your concomitant medication, right? So what is this concomitant medication? Or you can also call this as your concomitant and prior medications. That is, the subject is already taking some of the medications before starting this particular treatment itself or before participating into this particular clinical study. From here, you may feel little confused, but try to maybe by end of this domain you'll get clarity on it because your medical history, your adverse events, and your concomitant medication looks alike. Correct or not? So what medical history will deal about? What and all the previous medical history of the patient. Correct? It can be an accident, it can be a broken leg, or it can be anything, or what are the tablets, or what are going to be the various medications the subject was taking. What is adverse event? Anything unforeseen event happen. Because of that, the subject has taken some medication which is not your study drug or which is not your regular treatment. Now, what is going to be concomitant medication now? Concomitant medication also going to be in a similar terms. Anything that subject is taking other than your regular study drug. Any drug or any treatment that patient is taking other than your regular study drug. So slightly confusing, but you are going to get a clarity once you have clear details about all this. See that by end of this SDTM class, you should understand what type of data will flow into what domain. That is the overall objective. Okay. So for now, you may be little confused about this particular one, but you'll get clarity on this by end of this particular module. Okay. So for now, just try to understand that we are going to talk about concomitant medication. Right here it is, the C in the mind. It will talk about two different things. What are that? The drug that are, I can say that it primarily captures, I can say it primarily captures data, it primarily captures the concomitant and prior medication. It can be medication, it can be also a therapy, right? It is going to capture the concomitant and prior medication or therapies used by the subject. As simple as that. You can see one thing here. Whatever the concomitant medication that we are talking about, or whatever the previous medication that we are talking about, whatever the therapies that we are talking about here, these are not at all related to your. Okay, there is a question. How about the medicines that is taken for the drug side effects? Or they can be counted as concomitant meds? See, those are going to be your clinical events. Am I correct or not? So that's what I'm telling. See, some of your adverse event data will flow into your CM. Some of your medical history also captures your CM. But what you're talking now is going to be the side effects. What about the medicines that are taken for the side effects? Anything which is related to your side effects and symptoms. What is that? That is going to be your side effects and symptoms, both of them. These two are going to be fall under your clinical events. Right? Am I clear or not? See, there is going to be a what is it? Intersection between all this. Here it will talk about side effects and symptoms. When it comes to your adverse events, it will talk about any unforeseen event. Medical history will talk about previous medication, at the same time the accidents and other related stuff. There is going to be a delta between them. You can say that some of the data is flowing between the various domains as well. Is that clear? I think Mohan, you are the one who asked this. Clear, right? So you need to be a bit careful about it. And moreover, remember the raw data we are not preparing. Correct? So the raw data will come from the your sponsor itself. So you don't need to worry. But we need to know what data is flowing. That is the most important thing of, or what is that is the most important thing. That is the reason we are discussing. Okay. Please ask me these kind of questions. Don't hesitate. All right. So let's start with this concomitant medication. So we are going with the standard drill, like however we are doing all these days, we are going with the same way. So let's save this. Okay. So what it will talk about, I said to you just now, it is going to capture data about captures, concomitant, and any medication, prior medication or therapy is used by the subject. It will get captured here. Okay. So what is going to be the usual drill? Maybe I can open one of our AE notes and I can use this as a reference because I'm going to use the same thing. Okay. So we're going to talk about how it is going to store the subject, or store the data. That is the nature. Correct. So let's talk about the nature. So what is the nature of this particular domain? What kind of data it is going to store? It is going to be simple. It is going to store is one record for a recorded intervention, because it is recording something, right? Recorded intervention occurrence or constant dosing interval per subject. I'll talk about this, don't worry. See, one record is common, per subject is common. But in the middle, you got two things. What are that? One record per recorded intervention occurrence. That is, some intervention occurs. Something happened. Because of that, subject is taking this particular medicine. What kind of intervention happened? That intervention we are going to talk. One thing. Second, constant dosing interval. That is, suppose if the subject is taking one of the medicine called aspirin, let's say Dolo. How frequently he is taking? Let's say Dolo 650 mg is the tablet that the patient is taking. He is taking 4 times a day. For every 6 hours, he or she is taking this particular medicine. That information we are going to take, right? What is that? What is the medicine? That is, what is the drug? What is going to be the frequency? What is going to be the units that we are taking about, and how much is going to be the dosage? All these things we are going to record here. So one record for constant dosing interval or recorded intervention occurrence. That can be anything. Okay. So main thing that you are going to understand here, all this information, we are going to get this from CRL. That is, your case report form has all this data. Whatever we have in the case report form, that data we are going to capture here. Clear? So whatever the concomitant medication or whatever going to be a prior medication or therapies that subject is taking, everything will be mentioned in your C. Okay, right. So what is the next thing we are going to discuss about? We will also talk about what is going to be a topic variable. Correct? So here the topic variable is going to be, you can call this as CMTRT, concomitant medication. TRT stands for your treatment, or it is going to be therapy, or it is going to be medication, or it is going to be name of the drug. We will discuss this in detail when we go with the variable discussions. Okay, what are going to be your identifier variables? We also go with the identifier variables, right? So what are going to be your identifier variables? So common again. So the identifier variables are going to be here. We will start with your study identifier. Then we will go with your domain. So we all know the domain is going to be here as EM, unique subject identifier. And then we are going to talk about your sequence number, like adverse event sequence number, your medical history sequence number, clinical event sequence number. Similarly, concomitant medicine sequence number. CM, Q. We also have CMGRPID. You all know what it is. It is going to be for the individual group or for the common elements. What is the number that we have given? What is the ID that we have given? Correct? So this is going to be concomitant group ID. This is also going to be a identifier. So there is one last thing here, which is going to be CMSPID. You can also answer this. What is this SPID stands for? Can someone please tell me? What is this SPID? It is there in almost all the domains that we have discussed in the recent times. Can anyone please tell me? Anyone? Sponsor ID. Okay. Sponsor defined identifier. It is going to be sponsor defined identifier. It is there in every domain. You can see here AESPID will be there. Correct? Sponsor defined identifier. So remember, guys, there is going to be an interlinkage between almost all of your domains. So make sure you are going to have the detailed information about it. Okay, so let's start with the variable definitions. So let me start from here. I just copy paste this because these are going to be the same ones that we are going to discuss. Okay, so variable identification, we have started with the study ID, which is nothing but the study identifier, where it will be available. It will be provided by your sponsor and it will be available in your protocol as well as in your CRL. So domain, Domain abbreviation, it is going to be a 2-character long. When it comes to this, it is going to be CM. Then unique subject identifier, U subject ID, it is going to be a derived variable. It is going to be a concatenation of the variables called a study identifier, site ID, and the subject ID. Correct? What is the next thing? We have something called a CMSEQ. The CMSEQ stands for a concomitant medication sequence number. This is going to be the unique value at the subject level within the domain. Correct? You can see this subject we have 4, this subject we have 1 and 2. Any numeric number, but it is going to be a unique one. So it is going to be done based on the subject ID. So we are going to use the subject ID. Based on that, we are going to create it. You can also see that in your code. In the which one? See, the AESCQ we have defined based on your subject ID. If first of your subject ID is equal to 1, else you are incrementing the counter. Correct or not? So it is going to be a coded value, right? Guys, I'm going little faster here because we already know all these 4, right? So wherever it is already discussed, it is part of some other domain, we are taking it as it is. Okay, then we are going to take CM group ID. The CM group ID is also available here. So let me take it from here. Any questions from anyone? See, AE group ID, the similar thing we are going to take it here as CM group ID. What is the CM group ID is all about? Used to tie together a block of related records. What do you mean by that? For an example, okay, there is a question. Suppose the subject is taking amlodipine 5 mg daily for hypertension. Okay, so how many records? It is going to be only one. It is only going to be one. Subject, the frequency is going to be daily. The same medicine, the subject is taking every day, correct? The frequency is going to be daily. I'll show you the data, don't worry. Or if you get the question or if you have the doubt directly, I can also show you the data. Can you see this? So here, the same subject, aspirin is the one, 100 mg once, right? Suppose he is taking daily, every day he is taking, right? You can see 1, 2, 3, on 3 days directly he has taken. Again, 7, 4, 1, 4, 7 he has taken. Again, we can see that he has taken on 9. It's supposed to be 8, it's a printing mistake, right? So I think, Mohanty, is this your question? How many times the subject has taken? Yeah, this is the one. So suppose if the patient is taking on the daily basis, the frequency is going to be once in that particular day, because your start date and end date is changing now. So every day the subject is taking. So for every occurrence you are taking this. You can see that that's the reason we have mentioned it here on the top. Constant dosing interval, because the dosage is going to be constant, 100 mg. Every day the patient is taking. So we are recording that on day-to-day basis. Here you can see BID. BID stands for twice a day. The subject has taken that particular one twice a day. But here, you can take the last one. This particular one may be slightly confusing for you, but let me tell you this. The subject has taken this particular dose, that is 100 mg of the aspirin, from 1st of January to 9th of January. 9 days the subject has taken this. 9 days every day. But here we have mentioned the dosage as PR. So whenever this is purely depends on your answer. So this is going to be a collapsed data, this particular one. But this one is a detailed one. It purely depends on your sponsor. Here, the subject has taken the dosage from 1st to 9th. Totally 6 occurrences are there. All the 6 occurrences are recorded. Here, the same subject has taken this particular one from 1st to the 9th, but the dosage frequency we are not sure. So your sponsor mentioned it as a PRN. So that's the reason when I started this particular explanation, It purely depends on your sponsor. It can be on a daily basis. Any number of records that you can take it with a defined frequency. If the dose frequency is not sure, we can also go ahead with the PRN and we can go with the collapsed data, right? No. One record per dosing always we cannot say. Okay, let me tell you, there are other factors comes to the picture. That is, this particular drug, aspirin is the drug for evaluating your safety and efficacy. Whatever the study drug that you are taking care, that particular study drug efficacy as well as the safety is not getting affected by this particular drug, then sponsor can go ahead with multiple instances, but you can go ahead with a collapsed data like this. One way of explaining or one way of taking care. Suppose if this particular drug may affect the efficacy or may affect the safety of your study drug, in that particular case, you can go with one record per dosing like this. This example shows you both the scenarios. You got it right? It is not a fixed one. I cannot guarantee you that one record per dosing all the time. No. It purely depends on the sponsor, and also the other factors that will come to the picture is going to be the safety and efficacy evaluation of your. If it is not affecting, go with the collapsed one. But provided the sponsor has to define. It may affect, we are not very sure of it. It may affect, go with the detailed one. This is the perfect example of going with both the cases. Questions? Any questions from anyone? Is that clear, guys? All right, perfect. Anyways, the examples will come to the picture. I'm just going ahead with the main one, but still we can go with the any questions you can ask me. It will give you the clarity for everyone. PRN means I'll come to that. I'll come to that. Anyways, we haven't discussed the frequency yet. So let's discuss the frequency variable and I can explain what is this BID, what is this once and what. Okay. So you can go ahead with your dosage frequencies as ones. You can go ahead with the BID, that is twice a day. You can go with the PRN. You can go with Q1HS, all this. Okay, I'll come to that. All right. Where we are talking about the group ID. Group ID is nothing but we can tie related records together, and for all of them we can give the same name. We have seen this particular example in your AE events, adverse events. So a person, let's say a group of people are suffering from nausea. For all of them, all the nausea, we just given the number as 1. Let's say all the people are suffering, some of the people are having this vomiting sensation. All the people who are having this vomiting sensation, we have given the number as 2. That is, we can group the related records together. That is nothing but your CM group ID. So then the next one is going to be your sponsor defined identifier. This one also available in your AE. So I'm going to copy from here. So your AE SPID is nothing but your adverse event, but when it comes to the concomitant, it is going to be CM. It is also going to be a sponsor defined identifier, right? Either it is going to be printed in your CRF as an identifier, or it is going to be part of your sponsors operational database. It can be also line numbers in your concomitant pages, medication pages, right? It will be keep on repeating, guys. It will be keep on repeating. So no worries about it. Just make sure you remember this particular. So now then we will go ahead with our main topic variable. It is going to be a focus variable on your domain, CMTRP, which is nothing but your concomitant treatment, or we can also call it as a reported name of the drug, or it can be the medicine, or it can be the therapy. A reported name of the drug or a medicine or a therapy will be called it as a concomitant treatment. Okay, so CMTRT, this particular one, whatever is printed or whatever is going to be the medication name that is either pre-printed or collected on your CRF. Remember this particular one. So either it is going to be a pre-printed or collected on a CRF as is. Remember this. You don't make any changes. Whatever is defined, whatever is printed on your CRF as is, we are going to pick this particular one, right? So for an example, we just now have seen this, right? Just go with the examples once. So here the concomitant treatment is going to be aspirin. The subject has taken aspirin. So here you can see that it is going to be lithium. It is going to have BPA. Again, here it is going to be having some of your antidepressants. Correct? These are all going to be antidepressants. So you can see Zoloft, you have Prozac, you have Paxil. All these are going to be a antidepressants. So it is going to simply mention or whatever is mentioned on your CRF as is you are going to keep. Yeah. This is your focus variable. Guys, we haven't discussed what is the core. Is it a required variable or not? Study ID, 100% required variable. Domain, required variable. Unique subject ID, required variable. CMSCQ also a required variable. But when it comes to the group ID, it is not a required variable. It is a permissible variable. You may or you can also exclude this particular one. There is no need that you mandatorily need to group your data, correct? You don't need to mandatorily group your data. You can also exclude that particular one. When it comes to the sponsor defined identifier, it is also permissible because the name itself is telling it's a sponsor defined. It is going to be a sponsor defined. So clearly it is going to tell you, it is going to tell you if the sponsor is defined this particular data, this particular values in your CRF, pick it up. If it is not there, you can exclude it. So it is obviously going to be a permissible variable. This is 100% a required variable because it is going to tell about what exactly you are going to talk about. Clear? And one last thing, every variable, you don't need to define you don't need to look for that particular one in your specification Excel, right? So before even you refer this particular label or variable name in your specification Excel, you must have a clarity. Hey, this is the nature of the variable. Based on this, I can guess, or I can not even a guess, I can say whether it is a required variable or it is going to be a permissible variable or it is going to be an expected variable. That is the level of what to say expertise. That is going to be your expertise level that I am looking for, not me, anyone. Clear? So now we can see a group of variables we discussed. On these variables, we are able to identify whether it is going to be a permissible variable or a expected variable or a required variable. That you should be able to do it at your end as well. You don't need to refer your specification Excel to check whether it is a permissible or expected or required. All of you are able to understand what I'm trying to say? That is very, very important. By this time, because it's already like 4 plus 5, 9 domains we have completed. This is the 10th domain that we are discussing. So by this time, you should have this level of confidence. Clear? Can I go with the next one? Right. Now I'm going with CM modify. So do you have AE modify or not? Yes. The same thing we are going to do with the CM modify as well, which is going to be a modified reported name. It is not a term. Here it is going to be name. Primarily, we do this for the coding purpose. Primarily, we do this for the coding purpose. That is, we can modify the name as per our requirement, right? Whether it is going to be a permissible variable, expected variable, or a required variable. Anyone? Anyone? What is the core of this? Required, permissible, or expected? Team?
Expected, Murli.
Expected. Why are expected? Why it is expected?
Because it is related to CMTRD, right?
Correct. It is related to CMTRD. Okay. What is expected? Expected is something like it is good to have, or it is required. See, it is good to have even if I have some missing values, well and good. Correct. But who will define this particular name? Let's say there is a treatment. I just said that aspirin. What is going to be the modified name for the aspirin? Who will give that? It is not a medical dictionary. Correct or not? It is not related to the medical dictionary. It is not related to WHO. Who's supposed to give these details to you? The sponsor has to give it. Sponsor where will mention it? In the CRF, he will mention it. Correct? So can I say that it is dependent on the sponsor, right? It is not depends on your medical dictionary. It is not depends on something else, but it is purely depends on your sponsor. So now, whether it is expected or it is permissible.
Yeah, permissible.
Exactly. Now you can understand, right, why it moves from expected to permissible. But all of you are
Yeah.
clear that it is definitely not required, because none of you mentioned that it is a required variable. So I'm happy. Now you got a this clarity. You have some confusion between whether it is expected or it is going to be permissible. Now we go with one more step of analysis. From where I should get this particular data? Suppose if I say it is going to be decode. So we have AE decode, you have CM decode and all, correct? So from where we get this particular one? This is a dictionary. What is it? Not the dictionary, it's a standard name. Again, the standard name, who is going to provide it? In the AE code, it will be coming from your medical dictionary. Correct? Whatever is defined in the medical dictionary, you are going to get it. But here, even in this CM decoded, the next variable that we are going to discuss, again, it is going to be defined on your standard value. Who will provide it again? It again depends on your external dictionary, and that external dictionary here is going to be WHO. So if you have some dependencies, when the dependency will be defined by an external resource, you can call it as a permissible value as well. Expected means you have the standard value. Sometimes you can have it. When you don't have it, you're going to report it as a null, right? So eventually we are going to get a clarity on it. Don't worry. But for now, all of you clear that it is going to be a permissible variable? Cool. Now, the very next thing is going to be, I want to discuss this here itself. It is going to be ACM decode. Remember, it is not a dictionary derived variable. Here it is going to be a standardized medication name, because this is not the events. If it is events, you're going to correlate with your medical dictionaries. But here it is going to be standardized medication names. Who is going to provide it? There it is MEDDRA, MEDDRA, but here you are going to refer WHO. Who is going to provide this? This is WHO defined names, World Health Organization. Okay, in this domain, in this particular domain, if the particular value, let's say I have one of the drug, but the drug is not defined in your WHO yet. It's a new drug. It is not defined there. It is a FDA approval one, but it is not defined in your WHO. So obviously, you're going to expect a blank for that particular one. You can consider this as a permissible value. Okay. Then the next one is going to be CMCAT. which is going to be your categorization. I can simply say that medication category. It is a medication category. So what do you mean by medication category? What are the examples you are going to have? What exactly what we are going to understand from this particular one? Whatever the medication are, I can also say treatment category, because we also going to take care of the treatment. Medication or treatment category. So what are the various things we'll have? Okay, let me talk about the examples for this. Let's say you're going with some cancer related one. The patient may take some anti-cancer medication or has been taking them. Anti-cancer medication. Otherwise, some general concomitant medication, general meds. We can also call this as CONMEDs, guys. CONMED. CONMED will be a antihypertensives. So antihypertensives, yes, you can also go ahead with that. That is going to be called it as your prior, because the prior, this particular guy, oh, it is, you are talking about anti. Yes, yes, you can also call take this as an antihypertensives. Yes, but if the subject is taking hypertensive pills, you already have the BP, right? So for BP, the subject is taking the medicine because it's supposed to take on day-to-day basis, irrespective of whether it is related to a study drug or not. That is going to be a prior. It's a prior medication. Correct? All these are going to be your categories for your CMCAD. Okay. So let's go with one more step down. That step down is nothing but one level down. Subcategory CMSEAT. Correct? It is going to be subcategory of. It is going to be subcategory for medication. Okay. What are going to be the examples? We already talked about anti-cancer there. Correct? So now let's say that the subcategory is going to be, let's say the patient is going with chemotherapy, right? There is a possibility, right? Chemotherapy. Or the patient is going ahead with some hormonal therapies. All right. Oh, sorry, spelling mistake. Or the patient can also go with any alternative therapy for the matter of the fact. Right? All this you can consider, right? These are going to be subcategorization, right? So if you take your category as a cancer, under the cancer, one of the treatment is going to be your chemotherapy. You can go ahead with that. That is going to be a subcategory. All right. Then let's take one of the value from here. It is already present. This is nothing but CMPREST, which is nothing but pre-specified concomitant medication. It's supposed to go with your control terminology. The control terminology is going to be yes or no. Okay. What is going to be, if it is yes, what it is going to be? That is whether it is specified in your CRF or not. It is present in the CRF or not. If it is present, we need to mention it, whether it is pre-specified in your CRF or not. Pre-specified in CRF or left as missing. Anything you can. Either it can be missing. If it is missing, you are going to define it as N. If it is already mentioned, then you are going to call it as Y. Okay. So some related terms will occur. The next thing is going to be, I'm trying to take all the ones which are related here, guys. Oh, okay. Let me take MH. You have something called MH occur here. Oh. Remember we discussed this or I haven't updated this? We discussed about your MH occurrence, right? In the examples and all, whether it is occurred or not. Maybe I'm missing to update this here. Just give me a second. Here it is. Correct? Whether it is occurring again and again or not, we discussed this, but I forgot to update. Even the last class also, sometime when we are discussing this, the same thing comes to the picture. Okay, so no problems. Let's update it now. So we are going to talk about our next thing, which is nothing but occurrence of this particular one. That is, whether it is occurrence, the concomitant medication occurrence, we are going to mention it. Where it will be defined? This also will be defined in your CRF only. So we are going to talk about CM occur. This is nothing but your CM occurrence. What is the occurrence of this particular one? Either yes or no. Okay, only two things will be there, yes or no. Then it is also pre-specified in your CRF, else it is going to be left as yes. Then you're going to talk about CM stat, which is nothing but status, the completion status. What do you mean by the completion status? That is, it will give answer for your pre-specified medication, all the questions related to the pre-specified medications was answered in your CRF or not. All questions related to pre-specified medication were answered or not. If it is answered, it is going to be yes. If it is not answered, it is going to be no. Okay. If it is no, remember that. If it is no, then you need to give the reason for that. You remember this? This is also same thing we discussed in the other things as well. Maybe I can check it here. Here it is. Medical history event status. Similarly here, the medication status. Done or not. If it is not done, then you need to specify the reason for it. Let me capture this. This is the next variable for me. What is that? The status is the one. After the status, we need to know the reason for this. If it is not captured, capture the reason for CM not done. Right? Medication not collected, or captures reason for medication not collected. When it will come to the picture? Only if it is not collected. If the status is no, then only it will come. It is going to be a free text. Either it is going to be forget to ask the patient, or it can be patient left the site early, or patient refused to share the information. All these things comes to the picture. It is pretty much same as your MH reason. Guys, is this understandable? Right? Now, next thing, CMIND. What is that? CMINDC. That is nothing but indicator. CMINDC is nothing but indicator, or I can also simply call it as indication. What indication exactly it will talk about? It talks about why a medicine was taken or administered. Why medicine was taken or administered. What do you mean by that? So you're saying that we have taken one medicine, but why you have taken that medicine? For what reason? Right? So I have taken this particular thing. So because from quite some time Mohanty is using hypertensive. So let me go with that example. So the patient has hypertension. Because of that, I took it, taken this particular pill. Or the patient is feeling nausea. Or the patient is feeling vomiting sensation. So for what reason you are taking that particular pill, that indicates that is nothing but your CMINDC indication. Okay, the next one, CMCLAS. Simple things only, guys. medication class. This particular medication falls under what class? Simply, you can also call it as drug class, right? What is this particular drug class is? Okay. Again, what to mention is how to mention this particular one. This can be a single class or it can be multiple classes. If it is going to be a multiple classes, you are going to do this based on the direct dictionary. So you're going to have your WHO dictionary. Based on that particular dictionary, you're going to mention this. I'm going to give you the examples for this. In the examples, you're going to see this particular. No worries. It is simply which medication class or which drug class it belongs to. Nothing more than that. So the simple extension for this particular one is going to be CM class code. What is your medication class code, or what is going to be your drug class code? Right? It is also going to be obtained from the coding perspective only. So you're going to refer your medical dictionaries, that is your WHO dictionary. From there, you're going to get the details. Okay. Then CM dose. CM dose is all about dose per administration. That is amount of CMTRT taken. CMTRT is nothing but what pill it is or what medication it is. Amount of CMTRT taken, or simply you can say that dose per administration. Okay, then you are going to have a simple extension to this particular one, that is nothing but CM dose TXT. That is nothing but text. The previous one only, but here it is going to be dose description. You're going to have a detailed information about this particular one. Okay, this also can be called as dosing amounts or the range of dosing information collected in the text form. Okay, that is nothing but the dosing amounts, everything you're going to write, a clear information you're going to write here. The next thing, the related one thing is CM DOSU, which is nothing but dosage units. Simply the dose units. So what do you mean by dose units here? What is your dose units here? Can someone please give me the examples? Because all of us will take this medication. Wonderful, wonderful thing. It is going to be like milligrams, mg, it is going to be ng, or it is going to be mg per kg. All these things. ml, yes, keeps going. All right. The very next thing is going to be CM dose FRM, which form it is. It is going to be a simple dose form. What in what form you are taking this, right? What are the examples? Are you consuming this in form of tablets? Yeah. Or are you taking this as part oral? Yeah, it can be IV. Yes, anything. Or you're going ahead with something. Are you using some lotions? Let's say that you're feeling itching because of this particular drug, right? Or you're having this itching sensation already, right? So are you using some lotions on day-to-day basis? All this comes to it. All these are going to be examples, right? Now, this is the question you guys asked me some time back. What is going to be the dosage frequency? This is nothing but your dose frequency, or sometimes you can also call it as your interval, dose interval. For interval, dosing interval, yes, that is the right word. So it can be your, you know, twice a day, or it is going to be for every 12 hours, or it is going to be your once in a day. All these things comes to the picture. because you guys need examples for this. From this one onwards, I'm going to do it by tomorrow. Okay, tomorrow I'll do this. So we have dosage frequency. After this, we are going to talk about what is going to be the total dosage per day. We are going to talk about what is going to be our intended dose regimen. We are going to talk about what is the route of administration, right? So there again it will come. Maybe I should not use IV here. I'll tell you why. So I have a separate variable for it. That variable is going to be like, yeah, what is going to be a CM route of administration? Are you taking them orally? Are you using your intravenous? Or how you are taking it? That is defined by a different variable. That is your CM. Once you completed that, all the dates comes to the picture. That is nothing but your start date and time, end date and time, study day, start day, or again end day of your study, CM duration, your total reference period, your end reference period, start reference time point, end reference time point. With that, we can finish your. I can say that around 11 variables are still pending. These 11 variables with the examples, we can see by tomorrow. Okay, guys, I need you to start preparing. You guys are not preparing. So I need you to do that parallelly. Otherwise, by end of SDTM, immediately we are going to start ADaM. Once you start ADaM, you don't get any time after that. You don't get any time after that. So I request all of you to do this parallel. Okay. Anyone, any questions? Are we good? Perfect. Okay, guys. Let's connect tomorrow and we can continue to do this from by tomorrow. We can continue this by tomorrow.